Hi, let's do a quick scenario or clinical presentation on goiter. A 32-year-old female presents to the hospital with complaints of anterior neck swelling. What is your diagnosis? So the diagnosis is goiter, which is simply the enlargement of the thyroid gland. And after making a diagnosis, what questions would you ask yourself concerning the diagnosis? Is this malignant or benign? Is this hyperthyroidism or is this hypothyroidism? What are the morphological types of this condition? A diffuse and multinodular goiter. We have a solitary nodule, we have a dominant nodule in a multinodular goiter. How would you examine this patient? Before examining the patient, I'll wash my hands, I'll introduce myself, I'll also introduce the procedure to the patient, I'll position the patient, and then I'll expose the patient. After doing this, I'll then go on to inspecting the neck swelling, or rather the goiter. So palpate, I'll percuss, I'll auscultate. And then after doing this, I'll also do systemic examination. I'll examine the heart, I'll examine the musculoskeletal system, I'll also examine the respiratory system. So to time, that's how I can say. But in each and every step that I've mentioned, there are things that I would look out for to exclude other things. What investigations would you do? I would do my lab investigations as well as the radiological. So for the radiology, you might want to do your lateral neck x-ray. You also want to do your ultrasound. And then for your lab investigations, you want to be specific. So you want to do your thyroid stimulating hormone, thyroxine, which is T4, and triiodothyronine, which is T3. What pressure symptoms is the patient going to present with? Hoarseness of the voice, dysphagia, as well as difficulties in breathing. What's the medical and surgical management of this condition? Medical management, you can give beta blockers as well as carbimazole. And then for surgical interventions, you can do a partial or total removal of the thyroid gland. What are the complications of the surgical management of this condition? Complications of the surgical management can be classified according to the onset. There can be an early onset of the complications, an intermediate onset of complications, and the late onset of complications. On the early onset, this is where you have bleeding, hemorrhage, and hematoma formation. You can have tracheomalacia, you can have injury to the recurrent laryngeal nerve, and the intermediate, you have infections. Your late onset of complications, this is where you can have your hypothyroidism, among others.